Our bodies are made up of tiny cells that make up our tissue that allows us to live and breathe. Certain tissue, of course, has certain functions dedicated to helping the body work and survive. There are at least 11 body systems, as each one has certain diseases or cancers. Cysts are, however, abnormal, closed sac-like structures that contain substances, either gas, liquid, or semi-solid liquids. Not only that, but can also affect anywhere around the body. For this presentation, we will be only looking at cysts from the integumentary system. The integumentary system is a body system that includes hairs, pores, and skin. When said pores becomes blocked thanks to excess sebum, skin cells, and or bacteria, an infection can rise from the pore. Cysts usually occur when skin cells and white blood cells, more on the skin cells, are trying to be pushed out of the skin, but cannot due to a subject or misstep within the integumentary system that is blocking pores. This does not only affect the skin/body health, but also lowers one's self-esteem. There has been multiple cases of cysts being abnormally large pimple to melon sizes. An example would be tissue seen here. It was based upon the video by Dr. Sandra Lee, aka the Pimple Popper, as she is a dermatologist, which are surgeons who do what is known as an epidemic cyst removal. As you can see, it has been considered a growth, which is being swollen and abnormal. Looking through the photos, we can see that the growth has a sac-like being cut off. We can also see that like a balloon, the cyst is pressurized on the inside by dense skin and white blood cells. This forms what is known as pus. White blood cells are immunity cells that are part of the cardiovascular and immune system. They are meant to fight off certain diseases such as the common cold, fevers, and anything that seems like a threat to the body using antibodies. Like all cells, white blood cells have several parts such as the nucleus, cell membrane, cytoplasm, mitochondria, and much more. The cytoplasm is a gel-like substance that contains everything except the cell membrane. The cell membrane, being the outer part of the cell, encloses everything within the cell. The mitochondria is an organelle of the cell that works in energy production, but the most important part is the nucleus, which contains the DNA or genetic coding of a human being. For the white blood cells, they contain 46 chromosomes, which are segments of DNA. This means that the cells are diploids, as they are known to the full extent of DNA that they use and duplicate. When a professional does a surgery, there are multiple tools and procedures needed. For this example, I will be using images in order to call out steps. Certain tools needed are scalpel, medical scissors, anesthetic, and markers. Depending on the state of the cyst is in, different techniques such as trying to rip the cyst using their hands, pushing down on the infected area, or even sucking it with a tube may all differ. Though, in general, what is needed to happen is to label the opening in which the cyst will be removed. The feeling/pressure of the cyst, i.e. if it feels hard or soft, will have to be cut only with a singular 3-inch line by length or with a width more than an inch. Regardless, they take the scalpel and they cut open the cyst. What is important is surgeons must always inject anesthetic in certain periods as they go along the surgery. The person, depending on either the tolerance of fear or where the cyst is being removed, can be completely awake as long as you don't feel anything between injections. Professionals carefully cut up the surrounding flesh as well as to make sure not to cut up a large portion of the flesh or the sac itself. It is best to cut with medical scissors as it makes a quick, clean, and safe cut. They constantly push down on the cyst with their fingers in order for it to slide out the pus or sac. A surgery like this isn't complex and could take about 30 minutes or more depending on the size of the cyst. Once the cyst is completely gone either by cutting or pushing, the surgeon would simply check the inner flesh to see if there's any remaining pus. If there isn't, the surgeon could simply stitch up the wound to make sure there is no open air gap between the skin and body. Whenever doing any surgery, someone should always be holding a cloth, considering that the blood will leak out. The good thing about cyst surgery is that once done, the cyst growth will never come back. Depending on the person, they could take such medicines such as antibiotics, warfarin, or others. The scars themselves could easily go away in 2 months for most people. The wound must always be kept clean and dry. It's best to avoid certain activities that include taking too much time sitting. Some people who have gone through the surgery must go through different sorts of reconstructive treatments depending on the scar. Since these types of cysts are skin-based, it does not affect much of the internal or the external organs. It's not necessarily painful thanks to all the anesthetic. Though it may seem like a normal person could cut out their cysts, the reality is that they shouldn't. Dermatologists have been trained to stitch up a skin without leaving an open air gap. Overall, it is definitely something to recover by and will not scar a person for the rest of their life.